Sonia. I'm going to go ahead and be your nurse today. I'm going to go ahead and do some hand hygiene. And I'm going to have you state your name and date of birth for me, please. Mary Potter, 1997. All right, I'm going to go ahead and check your band. Yep, Mary Potter, 1997. All right, Mary. So my understanding is that you don't have any allergies. Is that correct? Yeah. Okay, I'm going to go ahead and hook up an oximeter on your finger and take your vital signs. All right. And I'm going to go ahead and let you know that you have an order to get a NG tube. I'm going to go ahead and just educate you on that really quick. So the NG tube is going to be placed to let your stomach rest for whatever reason. And I'm going to go ahead and measure from your nose, the NG tubing, from your nose to your ear down to your sigmoid process. And I'm going to go ahead and add 6 inches onto that after. And I'm also going to listen to your lungs. Let me grab my stethoscope really quick. I'm going to listen to your lungs once I have it placed in, and I'm going to listen to your stomach after. And you might feel a little bit of discomfort, and I'm letting you know if you feel any pain, discomfort, raise your hand at any point so that way I can stop. And do you have any questions for me? She states no, so I'm going to go ahead and do hand hygiene and ask her if she's in any pain. Can she rate her pain from a scale of from 0 to 10? She says she's at a 1. All right, so I'm going to go ahead and raise your bed a little bit, and I'm going to also have you tilt your head, okay? So when I'm putting it in, your head's going to be tilted forward, and I'm going to be placing it in. I'm going to give you a cup of water also, and you're going to be drinking it, okay? So when you drink, I kind of push in. And keep in mind that you need to raise your hand if you feel any discomfort, all right? Let's go ahead and raise your head now. All right. Have you sit up? All right. Okay, I'm going to go ahead and put this drape on you, okay? I'm going to go ahead and give you this cup of water. Okay. I'm going to go ahead and put the boob into the basin. Put the nurse cup. Okay. So I'm pulling it out. I'm checking to make sure it's all intact. All right. And I would pre-fill this with water to make sure that there is no holes. All right. So. Sorry. Okay. And I'm going to do that. Okay. All right, Mary. So I'm going to go ahead and put my line in after adding 6 inches to it. I'm going to go ahead and roll this in my lubricant. All right, so keep in mind, all right, raise your hand at any point. Start drinking your water for me, okay? All right, ready? Okay. Keep drinking your water, okay? You're doing good. Okay. So I reached my point. All right, I'm going to go ahead and take this down onto her cheek. I'm going to go ahead and tape the other piece down to her gown. All right. So I'm going to go ahead and take a quick listen, okay? Let me take this off really quick. Pressing this. Okay, let's take a quick listen, all right? You doing okay, Mary? Okay, so now go ahead and listen to her lungs. Okay, I'm gonna go ahead and listen to your stomach, in the 4 quadrants. Okay. Ooh. Okay. I'm gonna go ahead and take these gloves off. Put on hand hygiene. And I'm gonna go ahead and take a specimen, okay, Mary? And that's just to further check that you're in the area, I'm in the stomach, okay? Okay. Alright, pulling the content out. Let me check the pH. Alright, pH looks like we're in the stomach. Alright. Go ahead and take these gloves off. Alright, Mary. So I have, I'm gonna have a order for you to be sent up for x-ray to make sure we're in the stomach, okay? Then when you come back, we're gonna discontinue it as ordered by the doctor. Okay, she's back. Alright, Mary. Let's go ahead and disconnect it, okay? Are you tolerating it okay still? She states yes. Alright. Let me go ahead and glove up. Are you in any pain still? Any discomfort? No? Alright. I'm going to go ahead and get a drape on you. Okay? Now with this part, it is a little painful and you might have some gagging and you might puke, but it is normal. But at any point, if you have any need for me to stop or you start gagging, go ahead and raise your hand, okay? And I will stop. So, all right, you ready? Okay, let me go ahead and get all this tape off of you. Okay. You ready, Mary? Okay. Take a deep breath in, okay? Keep breathing normal, okay? 1. Okay, you doing okay? She stays. Okay. You're doing great. Okay. Good. You did really good. All right. So I'm checking the tip, making sure it's all intact, which it is. All right, Mary, you did really, really well. I'm gonna go ahead and toss this. You did really, really well. So I'm gonna go ahead and take this off of you. All right, Mary. So I'm gonna go ahead and just give you a napkin to wipe your nose. All right, so this next part I'm going to do is, the provider also ordered a catheter for you. So I'm going to go ahead and same thing, get a catheter going for you. I'm gonna go ahead and take this oximeter off of you. And if you have any questions. So for this part, you are going to feel pain, a little bit of pain, unfortunately, it's part of the procedure, and a little bit of discomfort. I'm going to go ahead and place my hands on your peri area, get you cleaned up, get you ready and sterile. This is a sterile process, so I need you to stay as still as possible. Try not to move, okay? And if at any point you feel like it's just too painful or anything, same thing, raise your hand and we can take we can stop, okay? Take a rest. All right, so let's get you laid flat and to waist level, okay? Okay, how's your pain? You still doing okay? She says yes. All right. Get your legs lowered. Get you a little bit higher, okay? Okay, so I am gonna uncover you, okay? Alright, so I'm gonna go ahead and grab a warm basin with a warm soapy basin, and I'm gonna get you cleaned up, okay? Do I have consent? She says yes. Alright. Let's get your legs up a little. Okay. Alright. So I'm gonna go ahead and clean with warm soapy water from one side and the other, and then down the middle. And I'm going to go ahead and get you ready, okay? So I'm gonna go ahead and do hand hygiene one more time. Okay, let me get rid of this also. Okay, and I'm making sure that it's not expired. None of my products are expired. Okay. Down. Okay, so I'm gonna go ahead and start from one side to the other. Okay. All right, so I'm gonna go ahead and do hand hygiene one more time. All right, Mary. Just reminding you, this is a sterile process, okay? So try to remain as still as possible. Okay. All right. So I'm gonna go ahead and put this. All right, Mary, still doing okay? So I'm gonna go ahead and you're gonna feel me touch, okay? Okay. Here in a little bit. Just need to get set up. Okay. Grab your move. Placing it on the tray. Okay. Tossing it. Okay. I'm gonna go ahead and just connect everything. Oop. Okay. All right, so I'm gonna go ahead and dip this in the lube. Okay. All right, I'm gonna open this up and I'm gonna go ahead and clean, open up and clean side, tossing to one side, tossing in the middle, inspecting her for any skin breakdown and making sure while I'm looking where I'm gonna go into her urethra. So I'm gonna go ahead and toss this really quick in the trash so it's out of my way. Okay. Nope. Okay. Over there, Betsy. Alright. Dipping. Alright. And making sure it's all intact also. Okay. Go ahead and take a deep breath, alright? Going in a little bit deeper, okay? All right, so I'm gonna go ahead and pinch it off. I'm gonna put 10 cc's in there. 10 mils. Okay. Okay, you still doing okay? All right, so I'm gonna go ahead and pull back. All right, making sure I'm in place, which I am. All right, I'm going to go ahead and place this on her leg. I'm going to go ahead and unwrap this, place this on the side of the bed where it's not moving. It's a non-moving area. Okay, so now that I'm not sterile, I'm going to go ahead and get you cleaned up. Just move these things out of the way. tossing them in the trash. Okay, taking off the gloves. Alright, and I'm going to go ahead and do hand hygiene. I'm going to go ahead and initial that really quick. I'm going to get you cleaned up really quick. That way you're not all with lube. Okay, alright, so I go ahead and clean her up. And I'm going to go ahead and also do a specimen, collect a specimen from you. So I'm going to go ahead and take these gloves off. Do hand hygiene again. Grab a new pair of gloves. Okay. Grab some alcohol wipes. So I'm going to go ahead and pinch off your catheter. Grabbing some alcohol wipes. It's strapped down. Okay. So I'm gonna go ahead and clean the port. I'm gonna go ahead and get this specimen collected. Alright, and this is just to check for any, what's going on, if you have any UTI or anything, you know? Any bacteria that shouldn't be present. Alright. Go ahead and collect it. How are you doing? Still doing okay? Alright. I'm going to go ahead and toss this and label this with her name, her date, her room number, and doctor and anything else, and send this to the lab immediately. Okay, I'm going to go ahead and deglove so I can get that catheter unpinched. And then do hand sanitize one more time. Get the catheter unpinched. Alright, so I do have an order to DC after this, so we're going to go ahead and DC this. Alright, so I'm going to go ahead and disconnect it, and it is going to be a little painful, so I'm just forewarning, and at any point if you have any pain, I'm going to try to make it as fast as possible so it's not too painful. And I'm going to go ahead, you go ahead and raise your hand again, and we can stop, take a minute for you to breathe. And do you have on a scale of 0 to 10, how's your pain still? She states it's at a 2. Alright, so okay, I'm going to go ahead and do hand hygiene. One more time. Okay. Grab a new pair of gloves. And I'm going to go ahead and put a chuck underneath you. Okay. Oops. Go ahead and chuck you. I'm going to uncover you, alright? And the chuck is just in case, you know, when I do pull it, there is some urine that comes out sometimes, so just be forewarned, lots of pressure, okay? Alright, let me go ahead and grab a syringe. Let me see. Let me go ahead and grab this one. Alright, Mary, I do apologize, alright? So it looks like we did get 10 in there. Oh, wrong port. So I'm going to go ahead and throw that one away and grab another syringe. And it looks like we had 10 in there. So I'm going to go ahead and pull 10 out. Are you doing okay? Any pain, discomfort? So I do have 10 pulled. Okay. All right, Mary. I'm going to go ahead and have you take a couple deep breaths. All right? Go ahead, take a couple. Okay. All right. So I'm going to go ahead, make sure that everything's still intact, which it is. I'm going to go ahead and measure the output that she has. Looks like it's at 140. All right. I'm going to go ahead and toss this. I'm going to go ahead and do hand hygiene again. We're going to get you cleaned up, okay? So I'm going to go ahead and get her cleaned up from side to side, in between. Same thing, checking to make sure that how her meatus is, her urethra, any swelling or tears that I should know about, and I don't see any. All right, are you still doing okay? So I'm gonna get you covered up. She states she's doing fine. Okay, so I'm gonna go ahead and just take my gloves off. Do hand hygiene. All right, let's get you back in a comfortable position really quick, okay? So after I discontinued that, it's common to have retention. Retention meaning that sometimes your bladder doesn't empty out, unfortunately. It takes some time for your brain to connect back to your sphincter muscles. And so before you get discharged, we do want to see some urine by 8 hours. So we're going to keep an eye on you, and with some Kegel exercising, we can get that strength back for your bladder, for normality. So I'm going to go ahead and get you covered up. How's your pain? Are you in any pain? No? All right. Do you have any questions or concerns for me? She states no. All right, Mary. Well, I'm going to go ahead and step out of the room and chart how you tolerated this. These procedures and your output and your oxygen, and I want to say anything else. So, all right, thank you. I'm gonna go ahead and do hand hygiene. Lower the head of the bed.